What is the Nidana of Vata, Pitta, Kapha dominant disease? How to understand Nidana of Vata, Pitta, Kapha dominant diseases? How to understand the relation between the Nidana and pathogenesis of Vata, Pitta dominant diseases, or what we can say the Sannipata diseases. This is the topic of discussion in this particular video. Dear ANL community, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Dear any community, this video go may little bit longer. Whenever we think about the Nidana of Sannipata diseases, or what we can say the Vata, the Kapha dominant diseases, the description is available in Ashtanga Hridaya Nidana Sthana, first chapter, 19th shloka to 23rd shloka. It is mentioned that Mishri Bhavat Samastanam Sannipatasthatha Punah Sankirna Jirna Vishama Viruddha Dhyashanadibihi Vyapanna Madhyapaniya Shushka Kama Mulakai Pinyak Mrityavasura Uti Shushka Krishamishai Doshatraya Karaistaistaistathanna Parivartanat Vrutordushtat Purovatat Grahaveshat Vishadgarat दुष्टान्नाद पर्वताश्लेषात् ग्रहेर्जन्मर्क्षपीडनात् मिथ्यायोगाच्च विविधात् पापानां च निषेवणात् स्त्रीणां प्रसववैषम्यात् तथा मिथ्योपचारतः. So these are the nidana that are being mentioned for the what we can say the Sannipata diseases, or what we can say the Vata, Pitta, Kapha dominant diseases. So here, if you look into these, spread this Mishri Bhavat Samastanam Sannipatas Puna. If the person is exposed to the Nidana that are being mentioned in the different dosha prakopaka Nidanas, if they are being taken in mixed proportions, that will be leading to the Vata Pitta Kapha dominant dosha vitiation. There will be Vata Pitta Kapha dominant disease manifestation. Further, it is being mentioned that Sankirna Ashana, Ajirna Ashana, Vishama Ashana, Viruddha Ashana, Adhyashana, etc. Vyapanna Madhya, Vyapanna Paniya, Shushka Shaka, Ama Mulaka, Pinyaka, Mrit Yava, Sura, Puti Amisha, Shushka Amisha, Krisha Amisha, Doshatrayakara Nidana, Anna Parivartana, Rutudushti, Purovata, Grahavesha, Visha, Gara, Dushtanna, Parvata Ashlesha, Janma Nakshatra Pida, Mithya Yoga, Vividha Papa Nishevana, Strinam Prasovvaishamya, and Mithya Upachara. If you split these, this will be the Nidana that are being considered to be the responsible for the Vata Pitta Kapha Dosha vitiation. So we are going to little bit detail of all these little bit explanations. Whenever it is being mentioned that Tiktadina Mishri Bhavat, so that is the Tikta, etc. Almost all the six rasa, if the person is going to take in excess, Sankirnadi Vishcha Sannipatah Prakupyati. So Sankirnadi Bhojana, Sankirna Vishama, etc. So that is considered to be responsible for the Sannipataja vitiation. So here the Hemadri says Sankirnashanam Apangteyaihi Sahabhojana Samashanam cha. So we are going to discuss them in the coming slides. So this is the reference available in what do you say that the Arunadatta as well as Hemadri commentary in the same chapter regarding the description of these Nidana. Sankirna Ashana, the first meaning, it is being mentioned that it is being considered to be Sankirna Ashana. It is one of the abnormal diet pattern mentioned by Hemadri in the context of Ashtanga Hridaya Sutra Sthana 8th chapter. So here this term Sankirna Ashana, that's having two different meanings. apanktyaihi saha bhojanam. So here that is mean considered to be apanktyaihi. So here the pankti refers to the people who are taking the food substances in a community. Apanktyaihi saha bhojanam. So that means if you are considered to be the pure vegetarian and you are going to take the food substances among the non-vegetarians, or otherwise if you are a non-vegetarian person and if you are taking the food substances along with vegetarians, of course this can be considered to be apanktyaihi, apankti bhojanam. This will be considered to be specific to individuals. So here, why so this is considered to be Sannipataka Prakopa leading to that. So that is, whenever if you think about the community, the substances they are going to add it in excess. For example, more spicy substances, more salty substances, or more sweet substances, etc., or more sour substances. So those aspects, whenever if you think about it, then that will be considered to be the responsible for the excessive dosha vitiation. Plus, variation in timing the food. So whenever if you think about it, if it is a large community, so that will be considered to be varying in serving the food. And habit of speaking. Whenever if you are taking the food substances along with community, whenever the food substance is being served, if it is being little bit delayed, then the person start to speak. It is being considered to be one of the major nidana, wherein you are going to suspect the dosha vitiation that may take place. And difference in the quantity of food intake. Whenever if you think about it, whenever if you think about the food intake, so that will be varying in different individuals. Still, the first person may take a little bit amount of the quantity. Second person may require a little bit large amount of quantity. Third person may require still large amount of quantity in that particular situation. So upon the bhojana, so that will be leading to the amount of the food substance in some of the occasions who may require little amount of the food, they may take too large amount of the food. In that way, the quantity of food intake that may vary. Difference in the prakriti of the individuals. Whenever if you think about it, the prakriti of the individual that may vary. The person who is sitting besides you, he may be of Kapha prakriti, and who is sitting on the other side, he may be having the Vata Kapha prakriti, and the person who is sitting beside them, he may be having Sama prakriti. Now, all these individuals, the amount of the food should be consumed that may vary. Of course, this again, apankti, in case of the pankti bhojana. So if you are doing that, there may be a possibility of the dosha vitiation there. Difference in the quality of the food. Some persons may require ruksha ahara, some persons may require snigdha ahara, some person may require laku ahara, some persons may require guru ahara. Whereas pankti bhojana, if you are doing that along with the uh, then along with the apankti type of the individuals, then there may be a possibility of again Vata, Pitta and Kapha dosha vitiation. Difference in the timing of the food. In some of the occasions, Madhura rasa substances will be served first. And in some of the individuals, Madhura rasa substances served at the end of the food. In some of the individuals, Madhura rasa substances are being served at the middle. In that way, the timing also may vary. So which again may lead to the Sannipata dosha prakopa. So here the term Sankirna Ashana refers to irrespective of the prakriti, irrespective of the physical strength, digestive strength, etc., the persons will be served same kind of the food substances. And in some of the occasions that may be served in excess To some individuals, that may serve less. In that way, so there may be a possibility of the Sannipata dosha vitiation. Second meaning, samashanam cha. It is being mentioned that samashanam. Pathya pathya mihai katra bhuktam samashanam matam. So in that particular situation, the pathya ahara and apathya ahara, that will be taken together. So if this is considered, so this may lead to the proper maintenance of dosha, whereas this may lead to the vitiation of the dosha itself. Suppose if it is being added with a little bit amount of the curds, etc., then we are going to expect the vitiation of Pitta as well as Kapha dosha together. In that way, so there may be the possibility of the inflammation that to take place in the alimentary canal if the person is going to take about the samashana. If the quantity of the apathya ahara, if it is of 60 or 70%, then the dosha vitiation, tiradosha vitiation may be to the maximum extent. If the apathya ahara is of 20%, the tridosha prakopa may be a little bit milder extent. This one what we have discussed regarding the timing of the consumption of food. Suppose if the person is going to consume pathya ahara first, then we are going to expect the pathya ahara here only, whereas apathya ahara we are going to take later. Then this will be associated with the cursor where it is being moving. That will be mainly concentrating on this particular part. If you are taking that on the anterior side, so this may be the area where pathya ahara may be situated. This may be leading to apathya ahara situation. In that way, we are going to expect the, what do you say, that tridosha prakopa. Whereas if the apathya bhojan is taken first, then we are going to expect the tridosha prakopa start at the beginning itself. Whereas on the lateral side, here that may be the area where there will be the possibility of apathya ahara stasis for longer amount of time. In that way, there may be a possibility of the dosha prakopa. As far as regarding the different ahara variations, for example, adhyashana. So whenever if you think about the term adhyashana, bhuktam purvanna sheshedu punaradhyashanam matam. So already the some amount of the food that is being remaining in the stomach, and the person is going to consume the food substances again. So this is also another example of adhyashana. But here, the amount of the food that is being remaining earlier may be comparatively of 10%. In that particular situation, that will be leading to, when you say that the adhyashana itself, whereas the person who is having the substance is 30 to 40%, then if a person is going to consume the food again, then also that is term is considered to be adhyashana. In both of these situations, so there may be a possibility of a tridosha vitiation. So we have to define the adhyashana accurately. Of course, which is considered to be one of the very tedious tasks, because the adhyashana, so that may produce varied clinical presentations depending upon the nature of the adhyashana, depending upon the quality of adhyashana, etc., depending upon the timing of adhyashana. So that will be leading to the tridosha vitiation. Whereas the vishamashana, so here there are the four situations where the person is going to consume the food substance. In the first instance, he is going to take the little amount of the food. In the second time, he will be taking large amount of the food. In the third time, he is going to take only little amount of the food. In the fourth time, he is going to take about large amount of the food. So in this way, the person is not consuming the food substances as per one's requirement whenever he is going to consume the food. This is what is considered to be vishamashana. This will be leading to the tridosha prakopa in due course of time. Viruddhashana. देह धातु प्रत्यनेक भूतानि द्रव्याणि देह धातुभिर्विरोधमापद्यन्ते. So that is considered to be responsible for the incompatibility regarding the body tissues. which in turn leading to the inflammation to happen in the lower alimentary canal, including the stomach, which is considered to be a part of the upper alimentary canal, plus lower alimentary canal, that is small intestine, large intestine. We are going to observe the inflammation, which in turn leads to the inflammatory markers to get produced in the alimentary canal, which is leading to the increase in the oncotic pressure. Thereby, influx of the fluid will be taking place from the capillaries of stomach, small intestine, and large intestine, which in turn leading to the metabolic derangement in the alimentary canal, wherein macromolecules which are being present in the alimentary canal are not converted into micromolecules. Thereby, that will be considered to be indigestion that is going to take place, which in turn leading to the depletion of stored nutrients in the body, in the adipose tissues, which will be entering into the circulation as circulating fat. In this way, so viruddhashana will be leading to the disease manifestation. Of course, viruddhashana initially that will be leading to the what you say that inflammatory markers, that is what we can see the Pitta Dosha vitiation, thereby influx of the fluid that is going to take place into the alimentary canal, where we are going to say the Kapha Dosha vitiation, and thereby that will be leading to the poor movement in the alimentary canal. There we are going to say the Vata Dosha vitiation starts to occur. Thus, Tridosha vitiation may take place. Vyapanna Madhya or Paniya. So that is the Vyapanna Madhya, Paniya Sura. In the sense, the intoxicating substances or the substances which are having the sour taste. So which is leading to the inflammation to happen in the alimentary canal. Thereby, we are going to observe the clinical features as we have discussed earlier, wherein inflammatory markers in the alimentary canal, influx of the fluid from the capillaries of the stomach, small intestine, large intestine into the alimentary canal. Thereby, Tridosha Prakopa starts to occur. Shushka Shaka. Shushka Shaka as such, so this is an example of Shushka Shaka, wherein the Shushka Shaka that will be leading to the movement of the fluid from the capillaries of the stomach or small intestine, large intestine. Thereby, that will be leading to the dilution of the hydrochloric acid, etc. Thereby, poor movement of the food substances in the alimentary canal. Thereby, we are going to expect Tridosha vitiation. Amamulaka. So that is the unripe radish. It is being mentioned in the text as Tridoshakara. In that way, so that will be leading to the vitiation of the Tridosha. Pinyaka. So that is the part which is being used wherein the oil is being extracted. That is the residue of the seeds of oil extraction. For example, here, so here Tilapinyaka or Sarshapapinyaka. So that is being considered to be the used which may lead to Tridosha vitiation. Mrit. So whenever if you think about the consumption of mrit, there may be a possibility of worm infestations. Plus, there may be a possibility of heavy metals poisoning. For example, lead acid batteries in two-wheelers and four-wheelers. Arsenic in case of agricultural pesticides or insecticides, etc. or semiconductors, etc. All these are leading to nutrition deficiencies. Thereby, we are going to expect the Tridosha vitiation in due course of time. Yava, it is being considered to be Ruksha, Shita, Guru, Swadu, unstable, Vitkrit, that is responsible for the formation of Vit, that is Purisha and Vata, Prisha, that is considered aphrodisiac, and Styria. If the person is going to consume these substances in excess, there may be a possibility of a tridosha vitiation. Puti Shishka Krisha Amisha. Puti Amisha. So this is related to the flesh, which is having the pus. Shushka Amisha, which is considered to be the dry flesh. Krisha Amisha, which is considered to be the flesh of emaciated animals. All these are leading to inflammation in the alimentary canal. That too, the Puti Amisha, that is pus mixed flesh. So that may be leading to inflammation of the alimentary canal. Thereby, we are going to expect inflammatory markers, influx of the fluid in the alimentary canal. Thereby, the poor movement that may happen in the alimentary canal. Thereby, the person will be having this tridosha vitiation. Whereas the shushka amisha, so that is considered to be the dry vegetables, as we have discussed, shushka shaka. So in the same way, the mechanism may occur. Whereas krisha amisha, where it is considered to be less nutritious aspect, wherein the person will be having the poor absorption of the nutrients, thereby the person may have the nutrient loss from the stored part itself. In that way, there may be a possibility of a tridosha vitiation. Dosha trayakara nidana. So that is considered to be the one example here. That is what we can say, the jaggery, which may lead to the, what do you say, that tridosha prakopa in due course, what we can say, the phanita. So here mandaka dadhi, so that is the dadhi curds, which is thick curds as such, which may lead to tridosha prakopa. Anna parivartana, that is kritanna bhojanat asatme bhojanat cha. Kritanna bhojanat, so that is purchased food preparations wherein the preservatives are being used, or consumption of unwholesome food substances, asatya ahara. So these are the examples where the person may have the tridosha vitiation. Rutudushti. So here the one example of the ati varsha, or here the one example of ati shita. If the person is exposed to these kinds of the rutudushti, there may be a possibility of a tridosha vitiation. So here the example could be, there may be a possibility of infection to get raised. Thereby, there will be the possibility of a tridosha vitiation. So here, the tridosha vitiation, before tridosha vitiation, it is the excessive shita. Thereby, the Vata and Kapha dosha vitiation may starts to occur. Later, there may be a possibility of a Pitta dosha vitiation. In that way, tridosha vitiation may occur. Purovata. The term Purovata refers to the exposure of the air from the anterior side. So the impact of tridosha vitiation, that may depend upon the intensity of the, what do you say, that the air from the anterior side and duration of the exposure to the front air and prakriti of the individual. So all these are necessary to determine the tridosha vitiation in this particular occasion. Whereas the exposure to the visha, that too, usually that depends upon the nature of the exposure to the Bahya Srotas. So the Visha are having the qualities Laghu, Ruksha, Vishada, Vyavai, Tikshna, Vikasi, etc. If you think about the Visha exposure to the oral cavity, we are going to expect the tridosha vitiation in the alimentary canal. If the Visha are being exposed to the skin, then tridosha vitiation starts to occur in the integumentary system. If the Visha exposure is being present in the eyes, then tridosha vitiation starts to occur in the eyes. Depending upon the nature of exposure of Visha to the body, we are going to expect the tridosha vitiation in the part exposed. Gara. So that is Nana Pranyanga Shamala Viruddhaushadhi Bhasmana Vishanam Cha Alpaviryanam Yogo Gara iti Smrtah. So, for example, the consuming the body hair or scalp hair. So that is considered to be an example of a, what we can say, the Gara, which is actually nothing responsible for the no major disease manifestation, but that is considered to be responsible for the mild disease or mild symptoms may be observed at the beginning. In due course of time, we are going to expect Tridosha vitiation. Dushtanna sevana. So that is Dushta apakwa annarasa. If the food substance is not prepared properly, then that may lead to Tridosha vitiation. Parvatashlesha, in the sense the people who are residing near the mountains. For example, so here the person will be having the there will be what we can say more amount of the air that is coming, but the mountain that prevents its movement. So in that way, there will be the movement of this particular air will be in the reverse direction. Same way, a cloud. So that will be moving there, and that will be responsible for the stasis of the cloud here itself. In that way, more amount of the, what do you say, that the hot air or rain may occur to the area where the mountains are being situated. That means there may be a possibility of an infection to get raised. In that way, Tridosha vitiation may starts to occur there. Mithya yoga, increased consumption of laddu, samosa, or payasa, etc., or increased consumption of contaminated water or pani puri, etc., increased consumption of dahi vada, etc., or vada pav, etc. All these are considered to be specifically related to the oral cavity. So we are going to expect the Tridosha vitiations to occur in the alimentary canal. Depending upon the exposure of the, what do you say, that Indriya and Indriyartha, we are going to expect the Tridosha vitiation. Vividha Papa Karma. It is been mentioned, Himsaste Anyatha Kama Vaishunyam Parushanrute Sambhinnalapam Vyapadam Abhidyam Drik Viparyayam Papam Karmeti Dashatha Kayava Manasahityajet. So here the Himsa Prani Upaghataha, that is producing the, what do you say, that the harm to the other animals. Steyam, that is stealing. Anyatha Kamam, so that is the desire for the socially unaccepted situations, such as the having the contact with the lower animals or etc. etc. So they are considered to be kaika papakarma. Paishunyam, in the sense, so giving the, what do you say, that the talking the bad words with the other people. Parushanam, parusham, that is rough words. Anritam, lies, telling lies. Sambhinnalapo, that is having the incomprehensible speech. They are considered to be vachika papakarma. Whereas vyapadaha, so that is pranyupaghata chinta, thinking about the uh, causing the harm to the other people or lower animals. Abhidya, paragunadi asahishnuta, that is having the jealousy. Vishayaspraha, drik viparyayam, so that is having the, what do you say, that pessimistic nature, etc. They are considered to be manasika papakarma. Whenever the person is having the exposure to either kaika papa or vachika papa or manasika papa, so that may lead to tridosha vitiation. Of course, whenever if you think about these, there will be usually the sympathetic nervous stimulation. Thereby, there will be the possibility of a tridosha vitiation in due course of time. Strinam prasava vaishamya. When you think about the prasava vaishamya, we have to define what actually prasava vaishamya refers to. That may be delayed labor, that may be considered to be excessive bleeding, or that may be considered to be premature delivery of the child, or constipation, or vaginal discharge, or urinary incontinence, back pain, hemorrhoids, etc. So, whenever if you are thinking about the prasovaishamya, we have to define what actually prasovaishamya refers to, which in turn initially leads to Vata dosha prakopa, and in due course of time there may be a possibility of a Pitta as well as Kapha dosha prakopa may starts to occur. In that way, these three prasovaishamya, that is what we can say the delivery related complications there may be leading to tridosha initiation. Mithya upachara. Whenever we think about the upachara, there are millions of opposed treatments are there for a particular disease, but only one is considered to be the right approach for any particular clinical condition. So that's why that has to be very clearly or meticulously examined, assessed, and that has to be implemented. Otherwise, there may be a possibility of a mithya upachara. So this kind of mithya upachara, why that is occurring? That is mainly because of the varied prakriti of an individual. His physical prakriti may be varying, his mental prakriti may vary, his emotional prakriti may vary, social prakriti may vary, and spiritual prakriti may vary. Because of all these reasons, maybe because of the cultural upbringing, or maybe because of his daily routines, etc., the prakriti of the individual may vary. And variations in the Nidana exposure that may also vary, may be related to only one Bahya Srotas or two natural orifices or more natural orifices may be getting exposed, and variations in the physical strength of the individual to cope up with the impact of Nidana, and variations in the clinical features of the individual, some of them that may be only related to Mahasrotas, some of them that may be related to the skin, some of the symptoms that may be related to the, what do you say, that the eyes, etc. That depending upon that, the clinical features, there may be a possibility of a mithya upachara. Variations in the assessment by the clinician, and depending upon the knowledge of the clinician also, the assessment of the condition of the patient that may vary. Depending upon the potency of the medicines that is used, that means one particular medicine that may be having the mruduvirya, same medicine which is prepared in the different place that may have Tikshna virya in that way, and variations in the nature of Samshodhana therapy. The Samshodhana therapy, the degree of Samshodhana therapy, that may also vary. In that way, the only one right approach is considered to be the ideal one for a particular clinical condition. If that is being analyzed properly, then only the person may have right kind of the treatment. Otherwise, it is always considered to be mithya upachara. In that way, we are going to expect the tridosha vitiation in due course of time, depending upon the ill judgment, depending upon misjudgment of the clinician, or depending upon the mistiming of the interaction with the medicines with that of the patient as such. To summarize, it is being mentioned that the Nidana Mishri Bhavat Samastanam Sannipata Punah Sankirna Jirna Vishama Viruddha Dishanadibhi Vyapanna Madhyapaniya Shishka Shakama Mulakaihi Pinyaka Mrudyavasura Puti Shishka Krishamshaihi Doshatraya Karaistaistaih Tathanna Parivartanat ऋतोर्दुष्टात् पुरोवातात् ग्रहावेशाद् विषाद्गरात् दुष्टान्नात् पर्वताश्लेषात् ग्रहेर्जन्मर्क्षपीडनात् मिथ्यायोगाच्च विविधात् पापानां च निषेवणात् स्त्रीणां प्रसववैषम्यात् मिथ्य तथा मिथ्योपचारतः. So, depending upon the timing of Nidana Sevana, depending upon the source of entry of the Nidana into the body, depending upon the number of the Nidana entering into the body, depending upon the virulence of the Nidana entering into the body, they are going to decide the manifestation of Vata, Pitta and Kapha dominant disease. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.